Good afternoon. I'm Anuj Mehrotra. I'm the Dean of the School of Business at George Washington University, and it is my pleasure to welcome you to this episode of George Talks Business. I hope you're all keeping good health. There are several of us in the GW community who are serving at the front lines of the pandemic. We want you to know that we are grateful for all your work and we take great pride in what you're doing. Today, our guest on this show is GW President Tom LeBlanc. And knowing how busy he is, especially during this time of the crisis, I really appreciate President LeBlanc taking and carving out the time to talk to us today and to be on this show. Thank you, President LeBlanc, and welcome.
Thank you, and thank you for having me on the show.
So, President LeBlanc, last time when you were on the show, we were talking a little bit about leadership, and we will talk about a little bit about leadership later on. But I wanted to start first by complimenting and saying we have heard from several faculty, staff, students, and alumni and parents on how measured and calm the response of GW University has been during this time of the pandemic. Now, I know that it seems like a long time back, but I would really like to start first by saying, what were you feeling perhaps 6 weeks ago when all this has started? And what were the emotions of the students, the faculty, et cetera? And what can you take us with the early steps of what you did and what some of the decisions were?
Well, thank you, Anuj. And I do want to send my best wishes to the entire community out there that's dealing with this pandemic. And as I think back, 6 weeks ago seems like such a long time ago. This came up on us all so fast. It's unprecedented in our experiences. We're very fortunate to have a great leadership team. We actually established a pandemic response team very early in this process that was looking very carefully at all of the science and the data and helping guide our decision making. I think the part of this that struck me as I think back about it is not only the great uncertainty, but how quickly everything was changing. We made decisions on Monday that we might have made differently on Thursday. And it was daily, we were getting new information, not only the spread of the virus, but concerns about models and death rates and testing. There was just a lot of information that was changing on a daily basis. And it was very difficult to make decisions that have big impact on students, parents, faculty, employees, make these big decisions without having a lot of good data. But it was important that our institution had, in prior work and in prior discussions, we developed a set of service standards for how we operate and a set of principles, and we applied those principles from the beginning. And they started with safety. As a major university, the safety of our students, our employees, all of our constituents was primary. And so all of the decisions started from the point of view of what's the safest decision we can make in this circumstance, and what's the most conservative from a safety perspective that we can make. We didn't start with a position around cost. We started with a position around safety. And so that helped guide our decisions very early on. But for me, I think the most important memory of that was how quickly everything was changing and how unmoored everything seemed in terms of decision making, which is why it was good to start with some first principles.
That's great to know. I can imagine at that time when it all started, we were all, at least I was, to some degree in denial as to how this thing is happening to us and here. And some of those things were moving very fast, as you said. Now, I know that you have had a lot of experience leading institutions through many different crises, including hurricanes in your past institution, for example. Was that helpful in responding to and setting up the committee, the pandemic response committee that you are talking about here? What were some of the characteristics you were looking for in people as you were forming those teams to be able to respond well to this? And are there any comparisons that you can talk about between preparing for a hurricane and preparing for this kind of a pandemic?
Well, that's a great comparison, and I do think that prior experience with hurricanes was helpful. In particular, I learned the importance of regular communication, particularly when safety is an issue. I also learned the importance of having the facts. When I was dealing with hurricanes, I also happened to have a marine school with experts on hurricane modeling, and every leadership discussion started with a discussion with the experts. What are the projections? What do the models say? What are the probabilities? What's the best data that we have so we could prepare for a hurricane that was coming in? We did the same thing here. from the very beginning, we put our experts in public health and in medicine in the room so that the first thing the leadership would hear would be their analysis of what they were hearing from their colleagues, what the CDC was saying, what the reports around the world were saying, and how we should interpret it and apply that knowledge to our local circumstance. So reliance on experts was one key thing that we started with, and also we used in hurricanes. The second thing was regular communication. Parents want to know that their children are safe. And so we started regular communication about hurricanes. Here we did regular communication about pandemics. We put up a website with an FAQ, and I've communicated with our community every Monday since this started. I communicate with the Board of Trustees formally every Friday since this started. So I think the communication has also been a critical part. And then helping people understand that we are working this through calmly with facts, with science, and that they can count on us to do the right thing. And I think we brought that as well to this. The big difference in this case, I think, is the massive uncertainty that we started with and that we continue with to this day. With a hurricane, there's a little bit of uncertainty, but the science is pretty good. And you know when the hurricane's going to arrive, more or less. You may not be able to predict all the damage, but you know when it's going to arrive. You know when it's going to leave. We've had enough experience with hurricanes that we know what the aftermath looks like, and we know roughly how long it takes to get back to normal. With this pandemic, the big difference is all of those questions are uncertain. We don't know what the new normal will look like yet. We really don't know enough about the virus yet. We don't have a vaccine yet. We don't know when we'll have a vaccine. So I think the uncertainty has added additional, certainly, angst around this issue and has complicated decision making.
So, President LeBlanc, you mentioned, that you had the access to some of the leaders in public health and in medicine and other places. Of course, GW, with its 3 schools of nursing, public health, and medicine, puts you kind of in the seat of being at the front lines yourself. So, do you think that GW is somewhat uniquely positioned to be able to handle something like this in a very good way?
GW is very fortunate, first of all, to have represented in our academic programs the very disciplines at the heart of this pandemic. We have a great medical school, we've got a great school of public health, and we've got a great school of nursing. And interestingly, all 3 of those schools are led by wonderful leaders, all 3 women, who've been involved in our pandemic response right from day one. We've been getting the best experts on their faculty, and the deans themselves have been involved in all of these discussions about what we can do, what we shouldn't be doing, how we can best prepare, how we can best respond, not only for the GW community, but for also our local community. We've been working very closely with our local community on healthcare and on dealing with pandemic models and other areas where that expertise has been invaluable. So I think we have been very fortunate. The contributions have not been limited to those 3 schools. For example, our engineering school helped make PPE equipment for our healthcare professionals. Our chemistry department donated some goggles that were needed. Just everyone has been pitching in. But I feel very fortunate to have the kind of expertise we have in our medical school, our School of Public Health, and our School of Nursing as we deal with this pandemic.
Thank you. So you mentioned a little bit about how we are also participating in helping the community around us. And we are, of course, right in the heart of Washington, D.C. So could you tell us a little bit about what we are doing in terms of meeting the needs of D.C.'s emergency response to this pandemic, and perhaps some of the inspiring stories you must have seen both in the community as well as on campus from this that has emerged?
Well, I think the GW community has responded in a fantastic way. It starts with our frontline healthcare providers. We have our physician practice plan, obviously, has been working very closely with the folks in GW Hospital to prepare the hospital for patients, to make sure that we had backup plans in the event of surge. We've offered facilities on campus for our healthcare providers to either quarantine or to spend the night when they need to rest and don't want to go home and possibly put their families at risk. We've had fabulous relationships between our physicians, the hospital, our medical school personnel, and our public health personnel. Everybody's been pulling together in dealing with this. Our physicians set up 2 drive-by testing sites, so that if you have a doctor's prescription, you could pull up in your car and you wouldn't be exposed to healthcare workers. They wouldn't be exposed to you the way they might in the hospital. So we could do testing. One of those stations was set up here on campus. The other one was set up at the United Medical Center. So we've been doing testing work. We've been doing healthcare work. We've also been doing research. Our public health folks are looking into novel tests that can be scaled up. Our medical faculty are doing some basic research on the virus. So there's a lot of different ways in which we've been contributing to dealing with this pandemic. And we've also worked very closely with health officials in the district who've been doing a fabulous job at making sure we were ready for any surge that might take place. And we offered our facilities to support that effort. They've also been very clear about the stay at home and other restrictions that help to manage this pandemic. And we've been communicating that clearly as well to our constituents. So I think it's actually been a moment in time in which people can understand that universities can provide great value to communities in a time of crisis. And I think GW has done that. I want to mention just one effort I had a chance to see up close this past weekend. The Department of Defense is very concerned about being able to maintain the Army, the Navy, the Air Force, all the branches of the service in the midst of a pandemic. And there is a company that is working on a self-administered test. And that company, with a contract with the Air Force, has now set up shop in the laboratories in our Science and Engineering Hall. And they hope to be able to do 50,000 tests a day out of that facility when it's fully ready. They've been moving in their equipment. I met with the head of the Air Force effort and the head of the company in Science and Engineering Hall. We had social distancing in play. We all wore masks, but I was able to see up close what that effort is. And that wouldn't be happening right now if we didn't have Biosafety Lab 2 standard laboratories that we could dedicate for that effort. So that's another way in which we're contributing to helping deal with and solve the problems of this pandemic.
This is great to know, of course, and I know we have also been in communication and collaboration with other schools and other universities, not only in the region but all over the U.S. for that matter. One of the questions that is on the minds of all of us, including some parents and students and faculty and staff, is how is the fall semester going to be? What will it look like? So, could you walk us through the steps of what might be some of the milestones in making a decision on the fall semester and what it might look like? Particularly, there are questions from some of the folks in terms of what will happen to the athletics, for example, and things of that kind. So if you can walk us through the process of thinking through it, that will be very helpful.
Sure. What we're doing, and I think most universities are doing the same thing, is we're setting up a series of contingencies. And everything starts with the assumption that we'll only do something if it's safe to do so. So this will depend greatly on what the district, what the CDC, what the federal government, Maryland and Virginia are all allowing us to do, frankly, and have decreed as safe to do. So that's the unknown in this planning. But we can map out a series of scenarios. I think under any scenario, in the fall, we will still be practicing some forms of social distancing. So almost anything we can imagine doing will probably involve more social distancing than would typically happen on a college campus. We might not have as many students in a residence hall or in a suite than we would have had in the past. We might not have as many students in a classroom as we might have had in the past. So I think at a minimum, we can assume a certain amount of social distancing will be required. But beyond that, we're looking at scenarios. We hope to be open and residential, and faculty and staff are back, even with social distancing rules. But we don't know yet whether that's going to be possible. So we're planning, one option is planning for that possibility and thinking about the impact on our classrooms, our residence halls, our workforce in offices and so on. So that's one option. At the other end of the extreme is this is continuing, social distancing and stay at home are still in order, and we can't have people back on campus, and we'll plan for that. We had 6,000 students online before the pandemic, so GW does have a lot of experience with online education and high quality online education. It's obviously not our preference, it's not the preference of our students, but we can prepare for that eventuality as well, and kind of everything in between. And obviously, we'd apply the same standards to questions like athletics. Athletics are not only about the competition, where you actually bring people together, but it's also about practice, it's about team formation, and there's not much social distancing in athletics around practice and team formation. So again, we wouldn't do anything that put our athletes' health at risk, but if we were allowed, I could imagine that we continue to have competitions. The competitions might be more local if there's still some travel restrictions. The competitions may not have fans if there's concerns about large gatherings. So we're working through kind of all of those contingencies as they would apply to everything we do. Our workforce, our students, our research, our classrooms, everything we do applied to the different contingencies.
Thank you. And I think, you mentioned earlier that, communication has been a key component of everything in the response. And I want to return to the topic of leadership for a moment here. How do you feel this leadership in a time of crisis is somewhat different, perhaps, from how you would be functioning as a leader when it is not a crisis? Although maybe for university presidents, it's a crisis all the time. I don't know. But what are some of the characteristics that you would, after this experience particularly, think of as very important characteristics that a leader should have during a crisis, in addition to the communication that you mentioned?
Well, I think this is different for several reasons. First of all, as we've said, the uncertainty. The uncertainty means that the normal decision process where you collect a lot of data and the decision process sort of flows directly from that data doesn't apply in a pandemic with so much uncertainty. So that's one big difference. I think the second big difference is the stakes in every decision are so high. I feel the safety of our community personally and very deeply, and would not want to make a decision that would put that community at risk. A lot of decisions we make can be changed later, they can evolve over time, but some of the decisions we're making right now could directly affect the safety of our community. And so the consequence of every decision and the fact that it's made in an uncertain environment just, I think, ramps up the importance and the difficulty of decision making. And then the third part is, in higher education, we often talk about and think about things for a very long time before we actually make a decision. And in this case, we don't have the time. I was stunned during 1 week in March when our entire country went from a distant familiarity with COVID to overnight closing businesses, canceling sports leagues, sending students home from school, online education, etc. It literally happened over a 4-day period of time. And so the speed with which we're making decisions, the stakes that are involved, and the uncertainty that are involved make it probably the most difficult environment for making decisions you can imagine.
So I completely get that. And I think we are all trained to kind of make decisions with scientific data, with evidence. And here there is so much uncertainty and very little data to go by. And there, as you mentioned, there's a speed at which you must make decisions because the impact of those decisions are going to be huge. So during these times, what guides you to make a decision? You mentioned, for example, having safety as the number one criteria, but the safety part of it can go to extremes where there is a fine balance between what the financial implications may be and other factors that you may have to consider. So what is the guiding principle to use, and what is that fine balance in making a decision when there is so much uncertainty?
Well, when I mentioned earlier principles and safety being a kind of principle one, we do have other principles. After safety, Our next service standard is care. And so all of the actions that we've taken have tried to take care into account, whether it's our students, our employees, whoever it might be in terms of our constituents. So that's the second standard. And then the third standard is efficiency. So we worry about how much it costs after we've taken care of the safety and we've taken care of looking after our constituents. So we do have those principles. I would say the other sort of overarching tool has been the science and the facts. We listen very carefully on a daily basis to updates on how this pandemic is proceeding within our community and within our country. So we're able to make decisions with that knowledge at hand, knowing that there's some uncertainty, for example, what will happen in the future, but we do know some facts about what's happening right now. I get regular updates as to how many patients are testing positive, how many patients are in the hospital, so we can actually see the pandemic kind of play out. I get regular updates on positive tests within the GW community, those sorts of things. So, the facts and the science are critical to this, having the principles, having the advice of a great leadership team from our AVP Scott Bernotes, who chairs our pandemic response team as the head of safety and security, from our dean of the medical school, Dean Barbara Bass, who is working with our physicians daily on the front lines, letting us know what's going on there. Dean Lynn Goldman of the School of Public Health, who has faculty who are not only doing basic research in this area, but are interpreting the models that are out there and giving us good information on what the future might hold. Dean Pam Jeffries of the nursing school, who can give us all sorts of advice and facts about what's happening to the nursing profession and how it applies to this pandemic. So having great leaders with great advice has been a critical part of this. And then having folks in communications who have helped craft all the communications that go out on a daily and weekly basis. Lorraine Bowles and her team have been enormous help as well. And then perhaps more in the background are the folks who actually oversee the finances of the institution, CFO Mark Diaz and his team, that are looking very carefully at making sure we have the resources that we need to deal with this and remain strong as an institution.
That's great. So President LeBlanc, some of the questions that were submitted also wanted me to talk a little bit about how people's lives have been impacted in so many different ways, and how, as a university leader, are you able to help people cope up with it? And in particular, how do you provide this voice of calm and inspire trust and confidence in what is going on?
Well, I think the first thing you have to do is you have to be honest with folks, even when the facts that you have to share are not great. We've been very upfront about not only what's happening from a medical perspective, but we've been upfront about what's happening from an institutional perspective. With the decisions we've made, we've tried to explain the decisions so that people can understand why we're doing what we're doing. With the decisions that we have to make, we're trying to explain the context that we're making decisions in so that people feel like they can be a part of the solution. We've had to make some tough calls. One of the decisions we made very early on was to tell our students just before spring break that we were going to online instruction for the next few weeks. And then just as they were leaving for spring break, we extended that to the rest of the semester, which was consistent with what we were seeing now about the spread of the disease. So those were difficult decisions that had impact on our students and their families, and we understood that, but we thought it was in the best interest. We also made the decision to pack up their belongings and store them so that we could prepare the residence halls for the future, uncertain as it might be, clean the residence halls and make sure they were suitable for use at some future point. We, again, were thinking about, first of all, safety and then the care of our students. So we actually were using FaceTime to help students see what was in their room and see the professional packers who handled their possessions with care as they were packing them up. And I think that provided some comfort to our students.
Thank you. So let me switch gears a little bit. Having you today on the show also wants me to talk a little bit about what you see how COVID-19 is going to change the future in terms of higher education. And you must be talking to a lot of different presidents. You must have your own thoughts. So maybe take us a little bit, not just in the short term, but take us 10 years from now. What do you think, how will higher education change potentially, and how can we prepare ourselves better for it?
Well, that's a great question, and I don't profess to have a crystal ball, but I can share some of my thoughts on that. First of all, I think although higher education appears to be something that doesn't change very much, we're actually changing all the time. We change aspects of the curriculum all the time. We're changing the problems we're working on pretty much all the time. Ironically, we change our student body. Every 4 years, there's a full turnover of our undergraduate population. So we actually do change a lot, but some things are basic and core to our mission and don't change as much. I think there will be some changes. I would say, for example, the use of technology through this pandemic has dramatically increased the number of individuals that will come out of this more comfortable with using that technology, whether it's in telemedicine or virtual instruction. So I imagine that online instruction will play a greater role over the next 10 years because more faculty are comfortable with it. That doesn't mean to say that I think all of higher education is going online. I think another thing we've learned from this pandemic is the value of face-to-face interactions and the value of community on a college campus. And I know I've heard from a lot of students and their families, they can't wait to get back to campus. So I think there will be a future for residential education at the university level, in my view, for many years to come. But that education will probably be enriched by a greater use of technology in the right ways, and therefore using the time on campus for more important ways in which education benefits from face-to-face interactions. We may also see more telework in the future, not only in business, but in higher education as well. We're in Washington, D.C., where real estate is very expensive and commutes tend to be long. People are actually getting back time in their day from not having the commute that they would otherwise have. And many of them are using it to exercise or otherwise have some personal time, mental health time, which I think is great as well. So I do see changes in the future, but I tend to be an optimist. I view higher education as a critical need for our society. I believe strongly in the role of residential higher education. I think there will be a role for it in the future, but there will be some changes, and they'll be for the good.
So thank you. I think one of the things that I do want to talk a little bit about is, we are seeing the financial prognosis for the U.S. economy is not looking good, at least for the short term. And that has to also have impact on universities and some of the financial realities that come into play. And universities have been, a lot dependent on philanthropic contributions from its alumni and from donors. Do you see some of those things impacting us in the near future or impacting universities overall? And whether or not you think that will shift with time and it's only a temporary thing, or these are some of the things that are worrying university presidents overall?
Well, I think every university president is worried about the finances. And let me say, perhaps the closest example we have to COVID is the deep recession of 2008, 2009. In a recession, a lot of things happen that have very big impacts on higher education. First of all, families struggle financially, and it's very hard for them to pay for higher education. Second of all, a lot of people do want to go back to school in the midst of a recession and upskill so that when they come out of the recession, they have new opportunities. So there's a negative on the one side and there's a positive on the other side. We also see in hard times like the recession that it has a disproportionate impact on different communities. And I think one of the things COVID has exposed is some of the basic fault lines of inequality in our country. I believe personally that higher education is one of the greatest forces for social mobility in our society. And we have to make sure that post-COVID, we're continuing to address inequality in terms of who can come to college, who can graduate from college. So I think that'll be something that all of us should be working on, and that's a very important part of our response as well. But overall, higher education is an important part of our economy. I think it's something like a recent essay, $600 billion industry in the United States. It's a global industry. We bring in students from all around the world to our institutions. Some of them, many of them stay and are productive contributors to our economy. The research that we do helps create innovation that's critical to our economy. So I think higher education plays a fundamental role and will continue to do so after the pandemic has passed.
Thank you. And I want to be respectful of your time, but I do want to ask you a couple more questions that were submitted. And they are more around your personal life overall right now. And one of them is really to the people want to hear about how you're spending your downtime, if you have any, first of all. And maybe you have a message and advice for folks to be able to cope up, for their well-being during this pandemic and lockdown. And then the second one, and I'll give you both of them together, is really during this challenging time, if you have any guidance that you want to specifically give the students as they are navigating through these uncertain times that none of us have really seen before.
Well, first of all, let me say that I feel very blessed. My wife and my two sons they're here in DC. They're all healthy. My son and my wife are in the residence with me. We have plenty of space. I can come to the office because literally there's no one else around. There's no one else in the office. So I'm actually doing this from my office across the street from the residence. We feel very blessed because we're healthy. I have a job. Not everybody has a job. And we're able to self-isolate and continue to work in a way that not everybody can. So we feel very strongly and deeply for those that have been much more negatively impacted by this virus. I will say that one thing I'm doing now that I wasn't really doing before is my wife and I walk almost every day. We take time out to walk in the neighborhood. We socially distance, but it's easy because, frankly, the Foggy Bottom campus is pretty empty right now. But we do walk every day. And something I would say to everyone, to the extent that it's possible, try to find some time for yourself. These are extremely difficult times. The uncertainty, the stresses of working from home, the stresses of worrying about the future, whether it's someone's job or someone's health, there's enormous stress out there now. And if you can find a little extra time for yourself, whether it comes from your commute, or some other fashion to either get some exercise or get some mental downtime. I think one of the challenges that we're all discovering is not only are we working remotely in kind of a different way, but I think my experience is that we're all multitasking. We're doing video chats while we're doing email, while we're doing something else. And at the end of the day, it's mentally exhausting. So trying to get enough rest is another key thing I would suggest to folks. Because if you're getting a little rest and a little exercise, it makes it just a little bit easier to get through these difficult times.
Well, thank you, President LeBlanc, for a very informative and inspiring conversation. And I hope you will return on the show when all of this is behind us to really tell us more, perspective after it is all over. And thank you all for joining us today. And of course, we are going to continue with more of George Talks Business Series. Some fabulous speakers are going to be announced very soon. So please stay tuned. And I hope to see you again virtually for the time being on this George Talks show. Thank you very much.
Thank you.